How is chemotherapy bone marrow suppression managed? Imagine your loved one going through chemotherapy and suddenly feeling more tired, bruising easily, or fighting off infections more often. These are signs of bone marrow suppression, a common side effect of chemotherapy. When chemotherapy drugs target cancer cells, they can also affect the healthy bone marrow, which makes blood cells. This can lead to fewer red blood cells, white blood cells, and platelets. Managing this condition is vital to keep your loved one safe and help them continue their treatment smoothly. Doctors monitor blood cell levels very closely during chemotherapy. They usually do blood tests before each treatment to see how the bone marrow is doing. If blood counts drop too low, they might delay the next dose or lower the amount of chemotherapy given. This helps prevent serious problems like infections or severe bleeding. But reducing chemotherapy doses can slow down cancer treatment, so doctors often use other supportive methods to help. One common approach is giving medications called growth factors. These drugs stimulate the bone marrow to produce more blood cells. For example, granulocyte colony stimulating factors help boost white blood cell counts, reducing infection risk. If anemia becomes severe, doctors might give red blood cell transfusions to improve energy levels. Platelet transfusions are also used if bleeding or bruising becomes a concern. Recently, a drug called Trilaciclib has been approved to protect bone marrow cells during chemotherapy. It works by temporarily blocking certain enzymes in the bone marrow, which helps prevent damage from chemotherapy. This can keep blood counts higher, reduce fatigue, and lower infection risks, making treatment easier to tolerate. Caregivers should watch for symptoms like unusual bruising, bleeding, fever, chills, or extreme tiredness. If these happen, it's important to contact the healthcare team right away. Simple steps like avoiding contact sports, practicing good hygiene, and encouraging rest can help prevent complications. Emotional support is also key, as dealing with low blood counts can be stressful for patients. In summary, managing chemotherapy-induced bone marrow suppression involves regular blood tests, adjusting treatment if needed, and using supportive medicines like growth factors and transfusions. Newer drugs like Trilaciclib can also help protect the bone marrow. As caregivers, staying alert to symptoms and providing comfort can make a big difference in helping your loved one stay safe and continue their fight against cancer.